We're here on the last day of the show at RSNA 2012. I'm joined by Dr. Eliot Siegel. Thank you so much for taking time out of your schedule.
You're welcome, my pleasure.
I've been really eager to get your impressions on the tone at this year's meeting and what's sort of permeating on the show floor.
So it's exciting for me to not only see the programs and the scientific exhibits and also the plenary lectures focus on more intelligent information systems, but to come by to see Carestream doing this and other vendors also realizing the incredible importance of being able to take intelligent information systems and make us more productive, more safe, and more effective.
Great, wonderful. Now, one of the things that's really been hot at this meeting is the whole theme of patient engagement and involving them in image exchange, for example. Do you have any impressions on the progress that's being made in that area?
I think we're making progress, but I'd like to see that progress happen more rapidly. And so if you watch Grey's Anatomy or House, it looks like the radiologist just kind of falls back in the background, and everybody's the radiologist. Everyone takes the images in the CT scanner, everyone interprets the studies, and I'd love to see we radiologists be recognized more by our patients. One way to do it, as was suggested at the plenary session, was for us to greet our patients and meet the patients, which I think is important, but maybe not as practical as some other possibilities. The other is to be more engaged with our clinical colleagues. But what I'd really like to do is engage the patient by empowering the patients to be able to have access to their images, to the reports, and then including with that educational materials. And so I'd like to have patients look at their images, look at their reports, and understand what are the implications of those, what do they need to do. And so creating the content of education and the reports and the images, and then have them understand what radiology is, I think is something that we can do using really clever information systems. So I'm really delighted to see Carestream making images and other information available on its portal, and I'd like to see more of that.
Great. With RSNA winding down, what progress do you hope to see the profession make in the next year as we come back to Chicago next year?
So I've been really interested in intelligent information systems. I've been working with IBM with some of the work they did with Watson, and have been fascinated and intrigued with the possibility of figuring out how to take the quantitative information that we gather in radiology and build it into intelligent systems that would allow the electronic medical record to be able to look out for patient care and use and consume the information to be able to improve our ability to make sure patients are getting appropriate follow-up studies when recommended, and that patients are getting the correct studies, and that the patients are being followed over time in an appropriate way. And I think that for the first time, we're seeing the capability of being able to communicate that information.
Well, I think everyone at the show is feeling the same energy, the same passion. It's a really great opportunity for radiology to step up and seize and head in a new direction. So,
definitely.
I think it's been a productive show, and I want to thank you so much for joining us.
Sure, my pleasure.